Creatinine. Regulation. Creatinine is a waste product of muscle contraction that is formed from phosphocreatine, a high-energy compound. Creatinine levels are regulated by kidney excretion. Measurements of creatinine in serum and urine, known as creatinine clearance, are used to assess the glomerular filtration rate, or GFR. Creatinine levels are not changed by diet or the rate of urine flow. Creatinine is not reabsorbed by renal tubules. Clinical significance. Increased serum creatinine can indicate renal disease or renal failure. Test methodology. One common method is the Jaffe method, where creatinine reacts with picric acid in an alkaline solution to form creatinine picrate, which is a red tautomer. Another method is the enzymatic method. Here, creatinine reacts with water to form creatine and water, which further breaks down into sarcosine and urea. This process involves several enzymes including creatinase, creatininase, and sarcosine oxidase. The final step produces hydrogen peroxide and an indicator that is reduced, signaling the presence of creatinine. Reference ranges for creatinine are typically different for males and females. For males, the range is 0.9 to 1.3 milligrams per deciliter. For females, it is 0.6 to 1.1 milligrams per deciliter. Creatinine clearance is a crucial measurement used to assess the glomerular filtration rate, or GFR. The formula for creatinine clearance is C in milliliters per minute equals U times V divided by P times 1.73 square meters over the body surface area. Here, P stands for plasma creatinine in milligrams per deciliter. U is urine creatinine in milligrams per deciliter, V is urine flow in milliliters per minute, and SA is body surface area, with 1.73 square meters being the average body surface indicator. To test creatinine clearance, a plasma sample and a 24-hour urine collection are required. The reference ranges for creatinine clearance vary according to age and sex and tend to decrease with age. For males, the reference range is 105 plus or minus 20 milliliters per minute per 1.73 square meters. For females, it is 95 plus or minus 20 milliliters per minute per 1.73 square meters. It's also important to note that correction for gender and race is required. The estimated glomerular filtration rate, or eGFR, is calculated using only a blood creatinine measurement and the MDRD, or modification of diet in renal disease, formula. Results are typically reported as a number only if they are less than 60 milliliters per minute per 1.73 square meters. Uric acid. Regulation. Uric acid, the major waste product of purine like adenosine and guanine catabolism, is synthesized in the liver. Uric acid elimination from the blood is regulated by the kidneys through glomerular filtration, and, some uric acid is excreted through the gastrointestinal tract. Clinical significance. Increased serum uric acid can be seen in conditions like gout, renal disorders, treatment of myeloproliferative disorders, lead poisoning, lactic acidosis, toxemia of pregnancy, and Lesch-Nyhan syndrome. On the other hand, decreased serum uric acid might indicate severe liver disease as a secondary disorder, tubular reabsorption disorders, or it could be drug-induced. All right, let's dive into the test methodology for uric acid. There are two primary methods used. First, we have the chemical method. In this method, uric acid reacts with phosphotungstic acid and oxygen to produce allantoin, carbon dioxide, and tungsten blue. The second method is the enzymatic uricase method, where the decrease in absorbance is monitored at 293 nanometers. Now let's talk about the reference ranges for uric acid. For males, the reference range is 3.5 to 7.2 milligrams per deciliter. For females, it's 2.6 to 6.0 milligrams per deciliter. Next, we will introduce ammonia. Ammonia is produced from the deamination of amino acids. Hepatocytes convert ammonia to urea for excretion. Type of specimen and storage. With severe liver cell malfunction, blood levels of ammonia increase. Ammonia is neurotoxic. Venous blood free of hemolysis should be placed on ice immediately. Blood collected in ethylene-diamine tetraacetic acid, or EDTA, may be used. Centrifuge the sample within 20 minutes of collection and remove the plasma. Plasma is stable up to 3.5 hours in an ice bath and stable for several days when frozen. Clinical significance: increased plasma ammonia levels are seen in hepatic conditions. Test methodology involves specific procedures to accurately measure ammonia levels in the blood. There are a couple of key interferences in ammonia testing. One is the incorrect handling of the blood sample, and another is ammonia contamination. The reference range for ammonia is 11 to 32 picomoles per liter.